is Mallory Jones, and I'm a registered nurse for Jackson Public Schools. I'm going to provide you with prevention strategies that you can use to protect yourself and your loved ones from COVID-19. But first, let's talk about what COVID-19 is. COVID-19, or coronavirus disease, is a respiratory illness that is passed from one person to the next in the form of droplets. That means that when a person is infected with coronavirus, the most common way that they can pass it on to someone else is via sneeze or cough. Imagine air freshener. Once those particles go into the air, the virus is in those droplets, and those droplets can go on the skin, inhaled in the nose, in the mouth, or even on surfaces, and they're able to remain there for an extended period of time. This virus is especially dangerous because it attacks the lungs, which affects the ability to breathe properly. That's why it is extremely important to make sure that we are gloving and we're putting on masks and that we're keeping surfaces clean. Symptoms of COVID-19 include but are not limited to cough, shortness of breath, fever, chills, muscle pain. Some have reported loss of taste and smell, as well as stomach upset. Although the virus affects people of all ages, it is our older population, those 60 and above, that are at greater risk. Those with other health conditions are at greater risk as well. Some of those health conditions are listed here, but I will name a few. Diabetes, high blood pressure, heart conditions, and obesity. Mississippi leads the nation in deaths from heart disease and also tops out that list in many other health conditions. Therefore, it is imperative that we implement strategies to keep ourselves and those around us safe and healthy. But how can we do this? I like to start from the inside of the body and work my way out. So let's start with the inside. While adhering to the stay-at-home orders and working from home, we're finding ourselves sitting down for extended periods of time. When we are inactive, our lungs weaken because we're not doing activities to strengthen and expand them. This makes us susceptible to respiratory illnesses and just makes us feel bad overall. Taking a walk around outside or inside can help expand and strengthen those lungs and to help maintain a healthy blood flow. It is important to nourish our bodies and supply it with beverages and foods that support our immunity, like citrus fruit and juices. Under any circumstance, we must always work to maintain an adequate intake of water. This helps to prevent dehydration and supports optimum bodily functions. Now let's cover hygiene and PPE. Right now, hand sanitizer is a hot commodity. And while there are many versions available, make sure that your hand sanitizer is at least 60% alcohol-based. Use hand sanitizer in the absence of soap and water. Soap and water is the gold standard when it comes to cleaning hands. And allow your hands to dry. They are not clean until they're dry. When coughing or sneezing, be sure to cover your mouth and nose with a tissue or use your upper sleeve. Proceed immediately to wash your hands with soap and water, and in the absence of soap and water, use hand sanitizer. Now, let's learn how to properly wash our hands. And while we're at it, let's get into PPE. Now let's put on our masks. Never be stressed enough that cleanliness leads to prevention of illness. Cleaning those surfaces that are most touched in the house, like your light switches and refrigerator doors, those are things that tend to harbor viruses and bacteria. So we must clean those often, like your doorknobs, those things that we touch daily, and they're usually with soiled hands. We must clean those and clean those very often. When getting in your car, think about how much we touch that daily. That needs to be cleaned to keep down infection. When getting gas, it is a good idea to use gloves when touching the pin pad or when pumping the gas. Just remember to properly dispose of your glove when you're finished. Bringing your essentials into the home, it is good practice to wipe down porous surfaces with a wet wipe and those non-porous surfaces with a disinfectant wipe. Another useful tip is just to transfer items into your own packaging from home. So let's talk office etiquette and reporting. As we are beginning to return to our offices, there is an increased need to pay attention to symptoms and keeping our workspaces clean, as you have learned from the beginning of the video. It is best practice to study yourself. Report any symptoms or fevers to your supervisor. If you have been in prolonged physical contact with someone that has been diagnosed with COVID-19, you must immediately notify your supervisor. This helps to surveil and curb the spread of the illness. It allows us to notify you if or when COVID-19 testing is necessary, and for you to obtain additional guidance. This is a responsibility that we owe to ourselves and each other to maintain safety. I encourage you to keep that line of communication open with your supervisor so that you can both send and receive information as it's made available to you. Okay, so let's recap. Ways that we can prevent infection of COVID-19 are hand hygiene, aka hand washing, gloving and masking when appropriate, social distancing, and keeping those surfaces and anything that you may bring into the home clean. And I'll leave you with some words of encouragement. This too shall pass. You are not alone in this. We are all in this together, and you have the support of the nursing staff here at JPS. I encourage you to teach someone what you have learned today. Please continue to be active and safe, and I'll see you back at school.